So what benefits do you see in using laser therapy?
Well, laser is cleared by the FDA in the United States as a heating device that increases microcirculation. So there's a lot of science that shows that laser does far more than that, though. That actually there's part of our cell tissue called chromophores that absorb this energy and can activate the mitochondria in the cells, which can help bring about clearing of inflammation and thus reduction of pain. And so there are several lasers now that are actually cleared by the FDA for treating a wide range of pain and inflammatory conditions. And we see it all the time with the musculoskeletal system. A person comes in, and often we would have used a lot of nutritional supplements, for instance, in the past, and now we use less nutrition, we use a lot of laser, and people spend less, and they do better, and they're happier.
Has laser therapy made it possible for you to treat certain conditions more successfully then?
A person came in with low back pain after having surgery a year ago, and they had had neck surgery 3 years before. And this person is 75 years old, and truly, even 5 years ago, I would have wondered, what can I really do for this person? And I love acupuncture, and I love nutrition, and they have ability to do so much. But some cases are so severe that I think it's out of that category at this point, where we really need these new developing technologies that work in a whole different way. They work very, very directly, and I can't think of a single person now who has not come in and gotten treated at least 3 to 5 times who is not glad they did and is usually starting to feel almost pain-free.
Using laser therapy, has that brought you more patients into the office?
Yes, and it brings them in more easily because they're spending less money on nutritional supplements. We used to commonly have patients spend anywhere from $100 to $300 or $400 on nutrition when they would come in. Their bill was typically $300 to $500, including the treatment and the acupuncture itself. And we found out that after a while, some people will do that, but they won't do it indefinitely unless they're getting amazing results. And when we started going more and more to laser and this energetic type technologies, people spent less, they come in more often. So actually the benefit to us is better because it costs us less, and they're more likely to refer in their friends or other people they know that have similar problems.
What you would say to a practitioner thinking about getting into laser therapy?
Do a little research, because it's no longer just in the realm of, well, does it work or not? There are so many research studies and papers that are written, most of them outside of the United States, most of them in Europe, Asia, and Russia, which to just spend one day reading through what different practitioners and clinics experience using laser therapy for a wide range of conditions, I think for any reasonable person it would probably wipe out most of their doubt and probably get them excited, which is what I started to feel more and more myself. Wow, what can this not help? Might be a better question than can it help anything at all? So we're just beginning to wake up here to laser in the United States, but I do feel that it is the beginning of a form of therapy that will come into the mind of the public that will be as big a wave as nutrition, perhaps, or chiropractic or acupuncture. That is how much potential is in using laser therapy. Because again, it's not just about treating this, but it won't work on this. It's about the health of the cell itself. And as you raise the health of the cell, maybe laser by itself is not the answer. And in many cases, I don't think it is. But a huge contributor to a wide range of conditions, especially as we use it now in the United States for pain and inflammation. There aren't a lot of people in the United States left that are over 25 or 30 years old that don't have some kind of pain and inflammation that they would be happy to be free of. And if they knew that there's a cost-effective way to not be on aspirin and Tylenol and painkillers possibly every day, that most reasonable people know, I can't do this forever. It's got to have some kind of negative effect. Well, Google those negative effects, and it might inspire you to want to find out what is a more natural way of dealing with pain.